So, as we begin to look at the pathophysiology of Parkinson's disease, it's important to first understand what this disease actually is. So, Parkinson's disease is a neurodegenerative disorder which involves the degeneration of dopaminergic neurons in the substantia nigra, which is a specific area in the brain. Dopamine itself is a neurotransmitter and a hormone, which transmits chemical messages across the synapse between two nerve cells. When it crosses this synapse, it binds to the postsynaptic membrane, where it's able to activate dopamine receptors, where dopamine can be used in body functions such as movement, memory, and motivation. In Parkinson's disease, as the neurons die and lose their functional capacity, it causes a reduction in these dopamine levels, specifically in the brain's basal ganglia circuit. So by the time Parkinson's disease is diagnosed and symptoms become apparent, approximately 60 to 80% of these dopaminergic neurons have been lost and causes a loss of function to the basal ganglial circuit. So this circuit has four main pathways which dopamine travels and is utilized by the body. This includes the metabolic, the mesocortical, the nigrostriatal, and the tuberoinfundibular pathway. In most cases of Parkinson's disease, the nigrostriatal pathway is impacted the most. In a healthy brain, this pathway facilitates movement through a direct and an indirect pathway. So the direct pathway is responsible for enabling movement and voluntary movement, with the indirect pathway impeding unwanted and involuntary movements. To ensure these pathways function effectively and controlled movements can be performed, dopamine is extremely important. So dopamine ensures the direct pathway is accurately activated while suppressing the indirect pathway simultaneously. When Parkinson's disease develops and dopamine levels are reduced, the function of the direct and indirect pathways no longer work together to facilitate voluntary movements. Instead, the direct pathway is not activated as often, and the indirect pathway is overactivated. So as a result, patients will tend to experience bradykinesia, rigidity, and a difficulty in performing voluntary movements the brain wishes. So looking deeper at the pathological features of Parkinson's, it is important to mention the presence of Lewy bodies. So Lewy bodies are intracellular protein aggregates, which have been researched to be found in the presynaptic section of neurons in patients with Parkinson's. Primarily, these Lewy bodies are made up of a protein called alpha-synuclein, which is an important component in the process of regulating the release of neurotransmitters. So Lewy bodies form when these alpha-synucleins misfold and build up to become an abnormal extension to neurons. More research is needed to fully understand the cause of this misfolding, but is currently hypothesized to be due to environmental factors and potential genetic mutations. So Lewy bodies disrupt cellular function in a multitude of ways, one of which is mitochondrial dysfunction. So the mitochondria are the powerhouse of the cell. They produce energy as adenosine triphosphate, also known as ATP, and is essential for healthy neuron function. So due to the degeneration of these neurons and reduction in activity in the substantia nigra, ATP production is also decreased, which causes an increase in a species known as reactive oxygen species, or ROS. So ROS places oxidative stress on cellular components like proteins and lipids, and essentially advances the degeneration of more neurons and advances the symptoms of Parkinson's disease. So when looking at treating Parkinson's disease, one potential pharmacological management is a medication called Sinemet, which is a combination drug of carbidopa and levodopa. So Sinemet itself is an anti-Parkinsonian. Levodopa is a dopamine precursor. So it is able to cross the blood-brain barrier, in which it is then able to be converted to dopamine into the brain. Carbidopa is a decarboxylase inhibitor, so it prevents the breakdown of levodopa, thus allowing higher concentration of available levodopa to cross the blood-brain barrier and be converted to dopamine. Whilst the primary indication for Sinemet is for Parkinson's disease, it is specifically useful for alleviating particular symptoms in Parkinson's, such as rigidity, tremor, and bradykinesia. So the alleviation of these symptoms is primarily why this would be a useful medication for Emma, as she is currently experiencing and living with these symptoms. So as a nurse, it is important to understand the medication you are giving your patients, not only to ensure they are well informed, but to ensure you can identify side effects and adverse reactions of the drug, which may need urgent care or attention. So one side effect of Sinemet is depression and suicidal ideations. So therefore, it's important to monitor how your patient is feeling mentally. Formally, you could perform an MSE. It could be conducted daily to help identify any decline or change in behavior or intent for suicide or self-harm, which could put the patient at risk of themselves. Other side effects also include dyskinesia, neuroleptic malignant syndrome, peripheral neuropathy, and orthostatic hypertension, all of which have an impact on various body systems. So periodically performing relevant assessments such as neurovascular and vital signs is essential in identifying these significant side effects early. Due to the levodopa, which is contained in Sinemet, dosages are frequently reassessed and altered for patients with Parkinson's in an attempt to balance the therapeutic effects with the side effects it causes. So as a nurse, it is really important to monitor your patients closely to help advocate for their health and comfortability whilst living with Parkinson's. Thank you for watching.